Hello and welcome to Social Security Update on METV, Manatee Educational Television. Our show today concerns Medicare, health insurance that millions of seniors and disabled Americans rely on for their medical needs. I am Darrell Rosenthal, Social Security Public Affairs Specialist, and I am privileged to have Carrie Lee Chambliss, a SHINE liaison, as my guest today. We are going to provide you with information that will help you become more knowledgeable about Medicare and tell you where you can go to get help with your insurance needs. Medicare and insurance can be so intimidating because there's so much information to absorb. But fortunately, SHINE can help people with these questions. Thank you, Carrie Lee, for being my guest today. It's great to have you on the show.
Oh, I'm very happy to be here. On behalf of the Senior Connection Center, the SHINE program, and the communities that we serve, thank you for having me on. I'm really excited to tell everybody about the SHINE program and how we can help them, especially with the annual enrollment period starting up on October 15th.
Okay, and what is the annual enrollment period?
Oh, great question. So the annual enrollment is 7th, and for people who are already enrolled in Medicare, this is their opportunity to freely make changes to their health and drug Medicare plans. For many people, this is the only opportunity that they're going to have throughout the entire year. So it's really important for people to start taking a look at their options and looking at what might benefit them for the next coming year. So any changes people make between October 15th and December 7th are actually going to become effective on January 1st of the following year. I would say by the end of September, all Medicare beneficiaries should have received what's called an annual notice of coverage letter from their current provider. It's really important for people to pay attention to these mailings and read the letter thoroughly, because that annual notice of coverage letter is going to explain to people what changes their Medicare plan is making. A lot of people don't realize that the plans themselves can change the services they provide from year to year. So drugs may no longer be included on the formulary. The doctor, the network pharmacy, the doctor networks or the pharmacy networks, those can change. Premiums can go up, out-of-pocket costs can go up or go down. So these are all really important things for people to look at and consider during the annual enrollment period.
I see. Well, that's a lot of information. So what is SHINE?
Yeah, so SHINE is part of a national program called SHIP, State Health Insurance Assistance Program. So the type of assistance that we're going to be talking about today is available across the country for everybody. And an easy tip that you can tell people about is that all Medicare beneficiaries should get this Medicare and You book every year. If they flip it over to the back cover, it will say SHIP and have their local program information right there on the back of the book. So it's a really great reference tool. If you ever run into anyone needing help with Medicare, they can get their local program information right there on the back of the book. As for SHINE in Florida, it stands for Serving Health Insurance Needs of Elders. We have volunteer counselors that have all been trained by Medicare in the state of Florida to provide free, unbiased advice and assistance with anything Medicare related. So we don't sell insurance or any products, and we're not affiliated with any insurance companies at all. The SHINE counselors are really just there to help educate and empower people about the Medicare system so they can make the best decisions for themselves.
I see. And I can say for everybody that I've had the pleasure of meeting a lot of your volunteers, and they're great people and they know a lot of information.
Yeah. It's something that I'm very proud to be a leader of for my team. Our volunteers are tremendous, extremely knowledgeable. We have some volunteers with our program that have over 15 years of experience doing the SHINE Medicare counseling, doing things like answering general or specific questions, providing those personalized plan comparisons for people, help with Medicare claims, appeals, billing issues, really anything Medicare related. Just looking at this book alone, it's a lot of information for anyone to try to go over themselves. So we're there to help guide people through the Medicare maze.
I see. That's great. That SHINE is there.
Yeah. And I think so people might have a little bit better of an idea about why SHINE is so important and how we might be able to help them with Medicare. It might be helpful if we tell them a little bit about the ABCDs of Medicare.
Sure. When it comes to Medicare, and if anyone has ever had to go to the hospital, you don't just have one bill. First of all, there's Part A, which is hospital insurance, Part B, which is the doctor's portion, There's Part D, the prescription drug coverage. So back to the hospital, if anyone's had to go to the hospital and they got all these multiple bills, first of all, you're billed by the hospital for staying in the room, the meals that you're given, the tests, the medications while you're there. That's covered by Part A. That's the hospital insurance. And then the Part B is for the doctors. So if you see a doctor in the hospital, which you would, or you see doctors either before or later on at their office, you're also going to need coverage for that. So that's the Part B. And then the Part D is the prescription drug coverage. So if the doctors you see in the hospital or at their offices then give you prescriptions, you're going to need coverage for that. So those are the basic parts of Medicare. And I should point out also, for Medicare, virtually everyone is going to be eligible for Part A. Social Security has a concept called being insured. And that's where you work, you pay Social Security and Medicare taxes, and you earn credits for the work you do. And this year, if somebody earns $5,040, they're going to get 4 credits. That's a full year's worth of work credit, and you need 10 years worth of work, which is 40 credits, and then you would qualify for benefits, and you'd also qualify for Medicare. So if a person hasn't worked enough, they can also qualify if their spouse has worked enough, or if their deceased spouse has worked enough. So most people are going to have worked enough to qualify for the Part A. And then the Part B is optional, but if you don't take it and you have no other insurance, you're not going to have full coverage. And the same thing for the Part D.
Yeah, and then one of the letters of the Medicare alphabet that you didn't mention is the Part C, which is the Advantage Plan coverage. And I know that can cause a lot of confusion for a lot of people. So the Advantage Plans are not actually a part of what you described, which is original Medicare. Part A and Part B combined is what comprises original Medicare. And then you have the option, like you suggested, of getting that standalone drug plan to cover your prescription expenses. That's an option that people have with original Medicare. The Advantage Plans, on the other hand, are not within that realm of original Medicare. We kind of refer to them as 2 different paths. So you've got original Medicare, or you can go the route of the Advantage Plans. And those are the private insurance policies, or the insurance policies that can be sold by private insurance companies. They're required to maintain a minimum standard of coverage that is equal to Part A and Part B and what that provides. But these Advantage Plans will often also incorporate additional levels of coverage or added benefits to try to entice people and bring them into their program. So I know with Shine, we talk to a lot of people who really want to be involved with the Silver Sneakers program, and that's not a benefit that you're going to get with original Medicare. But there are some Advantage Plans that are going to give people access to the Silver Sneakers program as an added incentive. A lot of times, the Advantage Plans may also provide vision, dental, or hearing coverage, and that's also something that original Medicare does not provide. Commonly, the Advantage Plans will also incorporate drug coverage into the plan. Not all of them do, so it's really important for people to be on the lookout for that. But the whole purpose of the Advantage Plans is to kind of make it a comprehensive package and bundle all the individual parts of Medicare together under one plan. And some people prefer that, but it really comes down to the individual needs and preferences of a person, and Shine can help them determine which path will be better, the original Medicare path or going that Advantage Plan route. Going back to original Medicare, there's also an additional part that doesn't get mentioned in the A, B, C, or Ds of Medicare, and that's what we refer to as Medicare supplement insurance. I think a lot of people might also be familiar with the term Medigap. Those 2 are synonymous. So Medigap and supplement insurance are the exact same, and they are not the same thing as the Advantage Plans. That's a common misconception that we hear. So the supplemental plans are also a policy that you can buy through a private insurance company, and that policy is in place to help pick up the remaining portions of your healthcare expenses that do not get covered by Part A and B. So people will refer to this as the 20% that Medicare doesn't cover. So that Medigap or that supplement plan will have its own premium that you will have to pay for, but it's there to pick up a lot of the extra expenses such as co-payments and co-insurances that go along with the original aspects of Medicare.
I see. That's some more great information. I'm glad you're here to explain all that.
Now, with so many different moving parts kind of working together when it comes to Medicare, when would you say is probably the best time for someone to enroll in a Medicare plan?
Okay, well, first of all, I think people should know when Medicare can start. So most commonly, it starts at 65. But also, if people are on Social Security disability for 2 years, that is also when you can be eligible for Medicare. Or if someone has end-stage renal disease, unfortunately, if they're on dialysis permanently or have had a transplant, and people that have ALS, Lou Gehrig's disease. So those are the different times when people can get Medicare. So, but the most common situation is people that are going to be retired. So to emphasize that, two different situations: those that are already getting Social Security benefits when they turn 65 and those that are not. So if you're already getting benefits when you are turning 65, you're automatically going to have the Part A, and then you're asked if you want the Part B. If you want the Part B, there's nothing to do. You're automatically going to have it. If you don't want it, there's something, a card. You're going to just say, no, you don't want it, and then you're not going to have it. And then for the Part D, you get that when you get the other parts of Medicare. So the Part D, you actually get that on your own. And while I know you're going to emphasize what Shine can do, but if somebody was going to do it totally on their own, what they do is they have to contact the insurance companies that offer the prescription drug plans. And there's a lot of plans. So the question is, well, what do you do? The Medicare website, medicare.gov, actually has a prescription drug plan finder that lets people list what prescriptions they're on, and it narrows the choices down. So instead of maybe 30 choices, there's 3. And that's a lot easier to deal with. Then they can just call the companies and make a decision. So what I've been talking about is what happens if you're getting benefits. And once again, the A is automatic, you're asked about the B, and then you initiate filing for the D, the prescription drug coverage. If you haven't filed for any benefits yet, or you're not getting any benefits, I should say, we're not going to know that you're out there and it's time for Medicare. So a person would have to initiate filing. What you do is you file 1 to 3 months in advance of your birthday. There's actually a 7-month period called an initial enrollment period. And so that's 3 months before to 3 months after. And you can apply any time during that period. However, for the Part B, it matters when you file, because if you don't file early, it's going to start late. So back to the A, you go ahead and you have to file for that. You can do that by doing it online at ssa.gov. The application should take no more than 20 minutes. But if you're not comfortable doing it that way, you can call our 1-800 number, 800-772-1213, and you make an appointment to either go into an office or have a claim taken over the phone. And then once again, that shouldn't take very long. And whether you do it on your own on the internet or you do it through an office, you're going to be asked if you want the Part B. And you'll tell us, so if you want the Part B, you'll have that at that time. And then you still have to initiate the Part D. But the way it works with the Part B, if you don't want it right away, there's going to be a penalty. If you don't take it right away and you want it later, there's a 10% penalty per year. So if you wait 5 years and then all of a sudden your health declines and you think you need it, you're going to be paying a higher premium. The same thing for the Part D. That goes up 12% a year if you wait. And a lot of people might think, well, I have no prescriptions, or I have just one. I don't want to pay a premium. I'm in good health. I'm only on one medication. But you have to remember, it is an insurance. So if you start off the year and you're in great health, but in July you have a severe illness, you might have some really expensive medications, and it's going to be hard to pay for them. So that's something to consider when you're first eligible for the Part D. You might want to take it as an insurance just as much as considering how much it's going to cost to you.
Well, I know you mentioned the Plan Finder on the Medicare.gov website as a tool that people can use to help with their prescription drug coverage and navigating those options. And you're right, there is a wide array of different options available to people when they are looking over their Medicare plans. So I want to just reiterate that that's absolutely something that Shine would be able to assist with. We have a lot of clients who are fairly tech savvy, but maybe putting in 20 plus individual prescriptions into that Plan Finder database and then kind of navigating through all of the results is challenging for them. And that's definitely where Shine can come in and kind of help them with that process. It's really important for people to be aware that it's not just the premiums that they should be looking at when they're considering which plan is best for them. You might have one plan that has a significantly lower premium and you're thinking, oh, this is the cheapest plan, this is the one I want to go with, but it might not have some of your very important prescriptions on their formulary, so it's always really important to check that. It might not have the pharmacy network or options available that you're looking for. The out-of-pocket expenses could be large, so it's really important to look at the big picture and a lot of different factors rather than just looking at the individual premium amount. So we can really help people compute all those different bits of information so they can come up with the best result. And then I know you also mentioned the penalties, and thank you, because that is a tremendous issue that we hear a lot of people talking about, is that they, like you mentioned, they didn't think that they needed a drug plan when they were originally eligible, so they didn't sign up. And then they needed that plan 5 years later, they've got a whopping penalty that they have to pay. So those are also types of things that people can call Shine about for assistance, so we can inform them, if you go with this option, you're going to have this penalty. If you go with this option, you're going to have this coverage, and really make sure they've got all their ducks in a row so they can move forward. Now, I know that we talk to a lot of clients who are still working at 65 and they kind of want to delay enrolling in Medicare. So, I mean, what kind of would be your idea of what someone should do if they're still working and they have group health insurance at 65?
Okay, well, that's a great question. And there's a special enrollment period for people that are working.
Mm-hmm.
And people need to know that when you're working and you have group health insurance, your group health insurance from work is actually primary, not Medicare. So if you're 66 years old and you're still working, remember, it's the work insurance that's going to come first. So with that information, the rules are a little different. You don't have to file for Medicare when you're still working and you have group health insurance because it is secondary. And then, so that raises a question, should I take Medicare if I'm working?
Mm-hmm.
And we don't advise people either way at Social Security. One thing that I suggest is somebody who does billing where a person gets their medical care, that person is going to be a good resource. So I would ask them, will the Part A help me? Should I take the Part B? Actually, most commonly people would wait for the Part B because that's $121.80 a month. And the Part A doesn't cost them anything, so they might take the Part A while they're still working. But I would still suggest they double check.
Mm-hmm.
So then what happens after they stop working or as they're getting closer to not going to be working, when there's about 2 months to go, let's say, to when they're going to stop, they should call Social Security and ask us for the forms that are needed to get onto Medicare at that point. So if they haven't filed for Part A, they still need to do that. But for Part B, there's a couple of forms they need. And the one form is just to say they want their Medicare to start. And the other form they take to their employer, and that verifies that they've had insurance the whole time, from 65 on. And then when they stop working, there's an 8-month period where they can pick up the Medicare without a penalty and without a delay. So that is the good thing. If you're working, you don't have the pressure of having to file for Medicare. It's a personal choice, and people need to educate themselves as to whether they should get it.
Mm-hmm.
It's those people that stop working, what they need to remember is that special enrollment period, and that exception is only when you're still working. Mm-hmm. So if you're able to carry your insurance after you stop working, it's not going to be primary anymore. It's secondary. So then you do need to pick up the Medicare. Otherwise, you will be penalized if you want it later.
And I think kind of what you were talking about with that verification letter that people need to get from their employer for Part B kind of goes along with what we consider creditable coverage. So that is one of the many caveats to Medicare that we like to tell people about, is not every employer counts as credible coverage. There's different rules and stipulations as to what creditable coverage is, and those are also things that Shine can help people navigate. Certain employee situations, if you're working for a very small private company that has maybe 5 employees, that's probably their insurance coverage that you have through your employer is probably not going to be considered by Medicare as creditable coverage. So in those circumstances, you actually would want to go ahead and apply to Medicare so you avoid those penalties. There's a lot, like I mentioned, a lot of different rules and caveats that go with Medicare, and those are things that we can help people kind of navigate. Taking a look at what kind of benefits they're getting through their current employer, and then looking at what the benefits would be compared to the costs if they were actually to go with Medicare. So we've seen it happen both ways, where some people have chosen to stick with their spouses or their own employer coverage, and some that have gone ahead and went ahead to enroll in Medicare. So it's really looking at the whole picture, and that's absolutely what Shine can kind of help with. Okay,
and as we've been talking, you've already highlighted some of the things that Shine does, but just to make sure you're not leaving anything out, what is an overview of all that Shine does?
I mean, really anything Medicare related, we're there to help people with. So that's general or very specific questions, whether it's on individual coverages or general enrollment questions. We often talk to people who are going to be brand new to Medicare and they don't know up from down, where to start, and they're feeling really overwhelmed. So like I mentioned before, we can kind of do a little hand holding to make sure people have all their ducks in a row and they can have that peace of mind that they're not making a mistake that's going to impact them for years. Giving them a penalty or anything like that. We also talk to clients, maybe they saw a commercial on TV for a health insurance policy that's promising all these great benefits. They can call Shine and we can kind of fact check and tell them, well, this would apply to you, but it's only available in certain other counties, and just really arm them with the information so they can make those decisions. Another thing that Shine counselors do are those personalized plan comparisons for the private advantage plans, the supplement policies, as well as the drug plans. So all of those different options we can kind of work with individuals. I remember distinctly one client from last year, he did what we find a lot of clients tend to do, which is just let their insurance ride. They have had a Medicare plan for the last 5 years and they just kind of stick with it and they don't really pay attention to the changes or anything like that. And this individual, he got his Part D drug coverage through the same insurance company he had a supplement plan from. Thought it made it neat and easy for him, but then he let it ride. So when he called Shine, he was paying about $7,000 a year out of pocket for his prescription costs. We set him up to work with one of our Shine counselors from his county and his community, and they worked one-on-one together, and the Shine counselor was actually able to find a plan that provided the same level of coverage for a little over $2,000 a year. So that's about $5,000 that we helped that individual save just by looking at those finer points and details that a lot of people don't know to check for. So the personalized plan comparisons are something we help with. We also help with Medicare claims, appeals, billing issues, situations. We had just a client last month. She received a bill from an ambulance that she didn't think she was going to be billed for. She was not expecting this $600 bill, and it was really, really stressing her out and making her worry. She was going to go into collections and all this stuff. She tried to appeal the bill on her own, and the Medicare appeals process is extremely complicated, and her appeal was denied. So on the denial letter, they actually included Shine contact information and told her that she could contact us for help. So we set her up with a counselor, again, from her county to assist her, and the counselor worked her through the appeals process, helped her formulate the letter, and that appeal ended up being successful, and the client was no longer responsible for that $600. So a lot of those types of things, like I said, really anything Medicare related, that's what we're there to help with.
And we're running out of time, so I just want to make sure we cover the most important things with the time we have left. And with all those great services that Shine provides, anyone can get the services right.
Yep, the Shine services are 100% free and unbiased for all current and prospective Medicare beneficiaries, their friends, family, and caregivers. Anyone can contact us by calling 1-800-963-5337, and that's 1-800-96-ELDER. So that you can use that number to contact your local Shine program, and we're going to work with you and try to assist you with that. So that's, again, for all current and prospective Medicare beneficiaries. I also want to mention that we have bilingual staff as well as volunteers on our team and a translation service, so we can assist really anyone who speaks any language, and I don't want that to ever be a barrier to prevent someone from calling. Another thing that I want to point out to everybody is that they can reach the Shine program by going to our website, www.floridashine.org, and they can learn a little bit more about what we do. They can also find some great resources to educate themselves, or they can submit an online request for assistance if they prefer to do so instead of calling into the office. So it's really there to help people and help them make those choices for themselves.
Okay, and just one other important thing that you do, more than one, but I want to make sure we mention this. You help with what's called the low-income subsidy. So can you explain that?
Yeah, thank you so much for bringing that up. I can't believe I almost forgot. So there's basically two main financial assistance programs that go along with Medicare that can help with Medicare costs. The first, as you mentioned, is the low-income subsidy, or LIS, also known as the Extra Help Program. So that's actually administered through the Social Security Administration, and that program, if people qualify, is aimed at helping with their Part D drug premiums, deductibles, and prescription co-payments. People will typically pay or can save about $4,000 a year estimated savings if they qualify for that program. It's really important for people to know those are income and asset based. So if you're making around $1,500 a month as a single individual, or around $2,000 a month for a married couple, you might qualify. So definitely call Shine or call the Social Security office to see if you might qualify and get help with those applications. I know Social Security assists with the LIS applications, and that's also a direct service that we do too. The other program is called MSP, Medicare Savings Program, and that's through the Department of Children and Families and helps with the Part A and B premiums, deductibles, and co-payments. Again, based on income and assets, but if anyone thinks they might qualify, we always say, when in doubt, fill it out. Give Shine a call and we'll walk you through the application process.
I see. The key is, in listening to all this great information, is people can be educated when they go into the Medicare process, because Shine is there to help. And so people can get on the Medicare website, they can get on the Social Security website, but still when they have questions, they should know they can always ask Shine, because it's a great service, and there's no reason for people to have to make decisions without having some of their questions answered.
Yep, we never want people to feel like they're on their own.
That is great.
Yeah. So I really just want to say thank you so much for having us here today. I want to implore everybody, if you know anyone who's on Medicare, tell them about the Shine program. You never know about how giving them our phone number and information might impact their lives and improve their health. And thank you to all of the Shine volunteers across the state of Florida. They're a constant source of inspiration for me and a source of hope for the people that we serve. So thank you for allowing us to talk about that today.
Oh, Ward, it's our pleasure, and I'm so glad that you were able to share that information, because it's great information for everyone to know. It really is. Thank you, Carrie Lee.
Thank you.
Well, we hope you enjoyed our show today, Getting Help with Medicare. I am Darrell Rosenthal, Social Security Public Affairs Specialist, and I'd like to thank my guest, Carrie Lee Chambliss, a Shine liaison. Thank you for watching Manatee Educational Television.